My name's Dr. Rachel Zoffness. I'm a pain psychologist in Berkeley, California, and I'm the author of the Chronic Pain and Illness Workbook for teens. That's a good question, and it's a question I don't think research has answered yet, the why. There's a couple of things that I think are really helpful, and one is that it does a lot of educating. So research on pain education has shown that that itself can be an intervention, because once you understand pain and you know what's happening to your body, stress and anxiety often go down, and that turns down the pain dial, which you can learn about in the book. So that's one piece of the puzzle. Another piece of the puzzle is behavioral strategies for pain involve what we call pacing for pain. And pacing for pain is much like pacing for a marathon. If you want to get better, we don't say get out of bed, tomorrow go back to school, resume your life, because that's not realistic. But a behavioral strategy for pain is doing a little bit at a time every day, both for your brain and your body. So maybe you start with walking a few minutes and reading a few pages of your math textbook, and that's all you can do for the first week, and that's okay. So the pacing actually warms up your brain and body. I think about, if you try and drive a car that's been sitting in your driveway for 2 years and you try and drive cross country, the car won't be able to perform. The oil needs to lubricate the engine, it needs to warm up, so I think of pacing as sort of like warming up an old car in the driveway. So there's a lot of strategies in CBT that are really, really effective for chronic pain.